Hello guys, I am Dr. Himanshu Dhawan and this video will understand if surgery is the right treatment option for varicocele patient or not. And what are the pros and cons of varicocele surgery? If you have been diagnosed with varicocele, I am sure you are thinking, is surgery the right choice for me? But before giving any conclusion, let us meet someone who has been through this. He was suffering from both varicocele and faced fertility issues while conceiving for baby.
Hello, my name is Shankar Chaudhary and I live in the Tonk district of Rajasthan. I had grade 4 varicocele, and along with that I was also facing difficulties with baby consumption, and I had no idea how long the varicocele had been there. After this, when I consulted the doctors required me to undergo surgery. After that, I thought of taking treatment by watching videos on YouTube. There, I found a video by Dr. Himanshu Dhawan on YouTube through Dr. Health. Through that video, I started my treatment here, and it's been over a year now. My grade 4 varicocele, which was bilateral, has come down to grade 1. Along with that, the difficulties with baby consumption have also been resolved. It's been over 3 months since the baby consumption issue got fixed. I took medication under the guidance of Dr. Surya Kansar, and I would like to thank Dr. Surya Kansar and Dr. Himanshu Dhawan, thanks to whom I was able to fix my varicocele in a normal way. I hope the baby will also get better soon. I believe that anyone with varicocele who has undergone surgery should definitely consider treatment in Ayurveda and maintain a little patience. Thank you.
As you just heard, varicocele surgery is something that doctors recommended, but surgery is not always the best option for everyone. Let me break it down for you a little more clearly. The truth is, surgery can provide some relief, but it is not always the ultimate solution. While it can remove the swollen veins and may reduce pain, it does not guarantee that your problem will be over, especially if fertility is already affected. So that is where things get tricky. Surgery does not treat the root cause of varicocele. It simply manages the symptoms by physically blocking the problematic veins. But what was the cause of the poor blood flow? It remains unresolved, which causes problems in future and can also worsen your situation even more. Surgery has its limitations, and this is where the patients need to think carefully. The biggest issues with the varicocele surgery is the risk of reoccurrence. Yes, it can come back. This happens because surgery does not treat the root cause. It only removes the damaged veins. The pressure on the remaining veins increases over the time and they can develop the same problem later. So you might end up facing the same situation again and again after a few months or a year. I have seen many patients who undergo surgery and feel better for some time. But then, after a few months or years, they start noticing the same symptoms again. Pain, heaviness, or even issues like fertility. This is called a reoccurrence, and it is one of the biggest drawbacks of surgery. Another thing to consider is that surgery does not really help improve fertility in many cases. If your sperm count or a motility has been affected due to varicocele, surgery does not guarantee that this will get better. Why? Because fertility issues are often the results of long-term effects of varicocele on testicular functions, and simply removing or blocking a vein does not restore normal testicular health. If your main concern is fertility, surgery might not give you the result you expect. That is why I always suggest considering the alternative before the jumping to surgery. I am not saying alternative are miracle either, but they focus on treating the root cause. Whether it is in Ayurveda, Homeopathy, Siddha or a Unani, these paths aims to manage the conditions, improve blood flow, reduce inflammation, and strengthen your veins naturally. Yes, it takes time. It is not an overnight fix, but the goal is to manage it without cutting any part of your body. For example, with the right combination of herbal remedies, exercises, and the lifestyle changes, we can improve the condition to the point where the surgery may no longer be necessary. In Ayurvedic treatment, we work upon fixing the root cause of the conditions. For example, if varicocele developed due to constipation, then we addresses the root cause issue is constipation first. Why? Because chronic constipation increases abdominal pressure, which can worsen varicocele. By treating constipation, we help reduce the internal pressure, giving your veins a chance to recover naturally. Similarly, if IBS is the reason, then we work on that, provide a healthy recovery from the condition. The aim is ensuring that the blood flows properly without putting too much load on the veins. And trust me, many patients have managed their condition successfully this way. So, the question is not whether surgery is good or bad, it is about the recovering naturally without cutting or damaging any part of the body. If you have already tried alternative treatments and they have not worked, then surgery can be the next step. But I always recommend talking to your doctor about all the options available. If you are still confused, then you can talk to my team, understand the pros and cons, and think about what is best for your body and your future. I hope this explanation has helped clear some doubts. If you have more questions or want me to explain any part of this in detail, let me know in the comments below. Until next time, take care of yourself and stay healthy and goodbye.